Rabbis of Beth Tzedec, and I am so delighted to be here with Debbie Berlin and Rob Kamen, two people who, as soon as I met them both, I kind of became slightly obsessed with them because they're pretty wonderful people on this planet. Deb and I both have our moms with us today, so that's really nice too. Shows how we're both homegrown here in this community, who are there in the background. And we thank Danielle Silverman being behind the scenes for doing our tech for this evening. And I just want to introduce our guests. We have a lot of questions and a lot to do in the time that we're together. This is the third of a series of hot topics, which are usually done during the days of Rosh Hashanah or Yom Kippur, but due to COVID, we're not able to do that. I see Judy here, but not Dina. Okay, so our presenter is absent at the moment, so I will give the introduction to our esteemed panelists today. The first one is, I'll go alphabetically. Deborah Berlin is a social worker and a psychotherapist who has worked extensively with various women's shelters and community organizations. Deborah practiced clinical social work in the, wait, Dina, you're there, but you're there as Judy. Okay, I'll introduce Debbie, you'll introduce Rob, and then you'll introduce the hospice little, perfect. Okay, Debbie practiced clinical social work in the Division of Hematology Oncology at the Hospital for Sick Children for 16 years, working with children with life-threatening illnesses in the blood and marrow transplant program and the pediatric brain tumor program. From 1998 to 2008, she was a member of the Health Sciences Review Committee for Bioethics and Research in the University of Toronto's Faculty of Medicine, and she served as Executive Director of Sheena's Place from 2014 to 2020. Deborah has a private psychotherapy practice and is a founder of Neshama Hospice, where she also serves as secretary. My very old friend, Dina Livman, is now going to introduce Rob, and then she's going to explain why she is part of this doing the introductions to me.
And it's not just because I first met Deborah when I was doing my social work internship at Sick Kids, and I went to social work school with Rabbi Friar Bodson, because the Jewish universe is this big, or the whole world is a shtetl, as they say. So Robert Kamen is Neshama Hospice's Director of Operations. He brings 15 years of clinical leadership at the University Health Network, specifically in nuclear medicine, patient flow, and clinical utilization, to his role as a consultant for independent health facilities that provide medical imaging services across Ontario. Robert is the nuclear medicine lead quality assessor for the College of Physicians and Surgeons of Ontario and chairs its National Examination Validation Committee for Nuclear Medicine. A health innovator, he holds multiple patents for shielding radioactive isotopes used in the diagnosis and treatment of cancer. Robert is a founder of Neshama Hospice. And I am pleased to introduce both of them because I had the pleasure of being introduced to Neshama Hospice about 3 years ago when the Azrieli Foundation, of which I am the Chief Strategy Officer, was approached, and I immediately got the concept, and I'm now very pleased to sit on the board of Neshama Hospice, which will be the first hospice purpose-built on Jewish values in Canada. And for those of you who aren't aware, the really deep need for hospice beds in the city of Toronto, it's really, really desperate. And residential hospice is in high demand, and it's really special, I think, that what Neshama is going to bring into the market. And if you think of it a little bit like Baycrest or Sinai, where it's not exclusively a Jewish population, but the Jewish values are imbued in everything that will be done. And people will have a sense of being in a Jewish environment, whether they're Jewish or they're not Jewish, all clients will be welcome. And so I'm really pleased to introduce them both and really look forward to hearing this conversation.
Thank you. Thank you, Dina, from your busy time being a super volunteer for us during the High Holy Days as well here at Beth Tzedec. So we have a bunch of questions. Some are for Debbie, some are for Rob, some are for both of you, but we'll start this one for you, Rob, which is, what motivated the two of you to start this project?
That's a great question. Thank you. It was really an interesting intersection in time. It was in 2014, and I met Debbie, and we started to speak, and it was sharing experiences. Debbie has a background from sick kids, and I was working at the time in a downtown hospital managing beds, clinical resources, and new hospitals had been built at the time. And as soon as they were built, they were full. And that was the system at a systems level. And at a personal level, I saw that I saw how families dealt with end of life circumstances, if you will, in the hospital setting, and that the hospital setting isn't the best place for end of life care. ALC was a big topic then, alternate level of care. And what that means is that hospitals are there for acute care purposes. And when patients need alternate levels of care, rehabilitation, or convalescent care, there's other facilities in the healthcare spectrum to handle those needs. End of life care, there was a significant shortage. And in particular, it's a difficult conversation for families to have and approach. So there was the ALC issue or concept, and there was the advanced care planning concept that was introduced at the time, and the intersection of all of those. So meeting Debbie and the intersection of everything that was happening, hospice presented such a simple solution to a very complex problem. And it's a solution that works for individuals and families and for healthcare systems. So it seemed like a very simple solution, if you will, 7 years ago. And it seems like the right solution today.
Thank you. Thank you for that really thoughtful and complete answer. I would love for both of you to answer this question. It's a two-part, which is, what does the Neshama Hospice add to your life? And just what's the value add-on to your life? I guess it's one question, asked two ways.
I'll go first.
Please.
I feel like Neshama Hospice is a bit of a dream come true. Having grown up in a healthcare household with geriatrician caregivers, my dad was a physician, my mom is a nurse. There was always a conversation about death and dying and advanced care planning going on, even before there was even a vernacular or any somewhat comfort level around it. Not to say that there's one that exists now, although COVID has pushed that a bit more forward, and we'll talk about that later. But I developed a comfort level early on in my life to living and experiencing people also dying, and knowing that it's very much a part of the cycle of life. And then having my experiences at Sick Kids and learning that hospitals by and large aren't necessarily designed as places for people to die, but they become the places where people end up going. And wanting to look at alternatives. So if people can't be at home, how do we create those environments for people where everyone is cared for? So being a part of that for me feels it's a privilege, it's an honor to be part of an organization linked to a board, and a greater movement that's now, as the word gets out, and just feeling like it's part of a movement. And I don't know, value added value. It feels pretty synchronous to me.
Beautiful. And Rob, how about you? What does Neshama Hospice add to your life?
Well, Neshama Hospice is about people. And the project is all about people. It's a passion project for me, but it's really a compassion project. It's a couple of years back, two friends of mine died. One was Debbie's dad. One was my cousin. And it's a part of living. But it's not a medical event as much as a life event and a social event. And my cousin died in a palliative care unit in a hospital. He was well cared for. He had family around, but there wasn't space for the social event that end of life is. And when the individual dies, the family leaves. You turn back, it's a hospital room. It was your home for 72 hours, 96 hours, but it's really just a hospital room. And it leaves a lasting impression that it can be managed better. Mm-hmm. And that's what residential hospice offers, is an alternative, another tool in the toolbox, an option.
Thank you. Thank you. Most of you that are watching and listening, I think from the list of who's here, know this, but I was blessed to work alongside Debbie in her volunteer capacity for over a year. First on Sundays, and then we moved to Thursdays here at Beth Tzedec for our Loss in the Time of COVID group. Which I have said to many people is probably the most meaningful thing that I have done here at Beth Tzedec as a rabbi, and just a huge privilege to know so many people's stories and keep them in that safe container. And learn, of course, from Debbie. How did that experience, being with these wonderful people, how did that experience influence you?
I still remember our first group. No, I remember we were just completing the year of mourning for my dad, and COVID started. And you could feel the energy in the shul because all the people were just taking in the information. And I think about how we decided to come together, and the raw vulnerability of people and the courage that each and every one of them, everyone had to show up and to share and be vulnerable. And there was no script. Like all my years of experience working with grieving families, working with families anticipating the loss or death of their children. This was like unprecedented. I know that word's been used a lot, but we made the glue. It was unbelievable to continue to see people show up week after week after week. And Robin and I talked about topics and themes and important things that people wanted information about, but what you so saw was the community and the connection between and amongst people on a screen. It was a life and learning experience that I feel like I'll probably never have again. And it very much made me realize, or reminded me just how important community is, regardless of people's experiences, where people are coming from, people needing to be seen and heard, especially given that people were so isolated, remembering that in the early days of COVID, there were no funerals allowed, no shivas allowed. People were still getting with Zoom, and there were huge gaps for so many people. when you think about all the symbolic, wonderful things that we do as Jews, when people die.
Mhm.
So again, using the words, it was an honor and a privilege.
Yeah.
And I learned a lot.
Me too. Me too. It was such sacred time. And every now and then you would talk a little bit about Neshama Hospice, but that wasn't the goal of that time. So I want to bring us back there. What do you think the ripple effects will be? Like, what's your dream once Neshama Hospice is actually up and running? For those of you who are listening and are not familiar yet, the physical place does not exist yet. It's not quite there yet. But what if you could dream, what would Neshama Hospice be the catalyst for?
You go first.
What I see, what I envision is building a compassionate community. So it's not just a place for 250 people, individuals at end of life. It's a place that supports families, that introduces school children to the circle of life, the cycles of life, normalizing end of life, and bringing people together so that as we experience these losses, we can grow and continue to live and appreciate what was and what continues to be. And death is very difficult. It's messy. Hopefully we can help to ease some of that and give a place for people to come back to and to contribute to and to grow with.
Thank you. Deb, do you have more to add?
Just a little. I honestly, when I think about, social distancing, yeah, but there's going to be green space where people can come together and have an early morning coffee. That it's a place where there will be a daycare for kids. There will be childcare so that people can actually be really emotionally and psychologically present with the person they want to be with or the people they want to be with, and know that their kids are being taken care of. And that there's age appropriate ways to work with kids also around death and dying. And I'm just giving some specific examples of what, but you think about smelling challah baking, being in a beautiful environment where your needs are met and you have 24/7 care. And yes, it's serving the Jewish community, but it's so important for people to know that this is also a public health initiative, that Neshama Hospice will be open to everyone, and that it's important to also understand that in the diversity of people's experiences, that when we think about Tikkun Olam and mitzvot, that we're also opening the doors and being inclusive and trying to really create a model of care.
Thank you for that. That we have a few connections between Neshama Hospice and Beth Tzedec. I have a teensy weensy little volunteer role on my own as a helping out with the culture committee. But we also have two people in the synagogue, Jay Feldman, who's not able to be here tonight, and Dina Livman, who started us off before, who are on the board. Dina also wanted to answer that question. She had a little bit to add as a board member.
Dina.
So when I think of what Neshama will bring to the table, I think there are two things about it. One is, what felt for me at the beginning of the pandemic, as Debbie mentioned, when funerals and shivas weren't even possible, is that when you think about what are the enduring things within the Jewish community, even among people who aren't shul goers or aren't largely connected to the community, It's around the rituals at the time of dying and of death, and a Jewish funeral, and Shiva, and why has Shiva endured? Because it serves a purpose. And there's so much to it. And so the idea that Neshama will bring to the conversation, what are the Jewish values around end of life? My mother has a thing, in Judaism, instead of wishing somebody a mazel tov on a pregnancy, we'll talk about besha'a tova, in a good hour. We wish for people to have good births, but we don't wish the same thing for people around death, even when it's inevitable. And my mother will say that she wishes somebody a good death, that they have dignity and peace and family and comfort. And those are values. And when I think about what Neshama will add to the fabric of the Jewish community and the general community, is yet another resource that will allow many more people to have a good death, which is so important because it truly is part of life. And if you think about it, we all remember the passings of loved ones. And the better the experience, not just for the person who's passing, but for those who are left behind, who, when they process what that was about, can have good, whole feelings. And that's what I really look forward to in what Neshama will bring.
Dina, I invite you to the mezzanine service on Thursday at about 11:30, and you can give the Isker sermon. So thank you for that. We're just going to change directions and ask a little bit less philosophical and more like tachlis, because I think people want to know a little bit like what's going on and why and how. Why isn't there a hospice based on Jewish values in Canada yet? I'm sure you've done your research. Like, why doesn't this exist? I mean, the Jewish community here has such unbelievable infrastructure. Why isn't there this?
I don't know that it's really well spoken about and well publicized or known. In fact, when we started the project, one of the significant statistics was the number of available hospice beds in the province versus the calculated need. So there was 250 roughly, and the need in the province was almost 1,100 beds.
Say there's only 250 hospice beds in the entire province.
In 2014, yes. So now there's more. There are.
It's growing.
It is growing, but it's an under represented, and it's not. It's because it's unknown. The impact and the need isn't quite realized.
It's important to also remember, though, that there have been huge efforts in Toronto to provide outpatient hospice care.
100%.
So Jewish Family and Child, they have always, Lisa Cronenberg and her incredible team of people have been doing end-of-life care, mostly in people's homes or in different locations for years. And I'm thinking of Richmond House.
And she's on your board also, right?
She
He co-chairs the culture committee with
Culture. Okay, but she's involved in the Neshama Hospice.
She's
That's what
quite
I meant to say. Yeah.
She is, and has been from the very beginning. Hill Hospice.
Hill House.
Yeah, Hill House. So it's important that we recognize that people have actually been doing this incredible work for a long, long time. Remembering, though, that these organizations have limited budgets and availability to people, and unless you have your own structure, it's a lot of running around and not always being able to provide holistic, comprehensive care, as opposed to having a hospice where you have 10 beds.
Right. So that's my next question. So, we 10 beds. Why 10? Why isn't there 100 beds? Why is there only why 10 beds? Where's this number about? Can you just explain that a little bit of how you came to that decision?
Well, it was a decision that was presented to us in a sense. We did respond to a expression of interest by the Ministry of Health to operate a 10-bed residential hospice. Beyond that, it really is quite an optimal number we're building 12 beds to anticipate future growth and service delivery options. But it really is an ideal number because you want this to be a home-like setting. People and their families and individuals need to feel that they're not in a large institution. It is a healthcare facility. There's special heating and ventilation and control mechanical systems for the building, but it really is somebody's last home. It's everybody's last home. So it needs to feel that way. And smaller than 10, it's the optimal number in terms of economies of scale, if you will, from a management or an operating point of view. But really, it's to be able to provide that service on an individualized nature.
Thank you. So for people who are listening, can you describe what these 10 rooms will be like?
Oh, this is like one of the best parts of like imagining the vision. And I want to mention here Charles Rosenberg, who has been our architect extraordinaire from the very beginning.
And coincidentally, a relative of mine.
Yes, you've said that. And he is also, his portfolio includes many community-based builds. So he is very well acquainted with, as Rob was just describing earlier, the systems that need to happen in these types of residences. So him participating in the vision, when you imagine a bed, but a beautiful bed where someone else can be in it. And that bed can be rolled out through the French doors into a garden. And that bed can also go into the family room so that a family member can hang out with their grandchildren. And you have privacy, beautiful natural light, lots of wood, and real comfort. I start to think about colors and linens and all the things that would, as Dina described, providing that respect and that dignity. When you think about people and creating comfort and sanctuary, and really trying to make it as home-like as possible, removing the institutional barriers, but also needing certain ones to promote safety. And when we have been looking at the plans, at the architectural designs, how it will really blend into the community, that it's not something that is going to be standing out and drawing negative attention, that this is something that everyone is committed to seeing as becoming part of the community in North York, and doing important outreach to our neighbors, but making sure that people are also informed and educated about what end-of-life care means and hospice care means. Because sometimes people have misinterpretations of what a hospice actually is.
Which leads me to my next question, which is, and I think some of us get confused in this. There's a lot of terms that we hear. How would you differentiate between end of life, hospice, and palliative? Those are three different words. I mean, I'll get an email or a text from Rabbi Friedman Cole all the way in Israel that he'll say someone is palliative. First of all, it's how do you know that you're in Israel? But before we do over here. But there's just all the different terms. I don't think they're all the same. So hopefully if you could differentiate them for those that are listening.
Okay.
Go ahead.
So palliative is a spectrum, is a continuum, if you will. So somebody may receive palliative care when they've received a life-limiting diagnosis, but it doesn't mean they're immediately symptomatic or they're unable to continue living a normal life at the time that they receive their diagnosis. End of life is a portion of that time continuum,
But
where
finite.
But it's finite, It's for a residential hospice, typically it's 3 months or less, a prognosis of 3 months or less. Palliative care,
Years.
it can be years long and supports ongoing therapeutic care. It's an adjunct to therapeutic care. And when therapeutic care ends, palliative care continues. Perhaps one distinction to clarify is the difference between a palliative care unit and a residential hospice. So a palliative care unit is in a institutional setting, in a hospital setting. It does manage individuals at end of life, but it's more medically intensive, if you will. Residential hospice is not demedicalized, but it's focused upon the provision of comfort care and meeting an individual's holistic and spiritual needs, as well as their care needs, their medical care needs. So it's setting dependent, and it's also the level of care that's afforded, if you will.
Thank you. Thank you. Hope if anyone else has questions, by the way, just put them in the chat and we'll get to them at the end, because I know it can be a little bit either complicated or easy depending on who you are. You know, you've mentioned a few, you've mentioned Ontario government, you've mentioned JFCS. Who are your other partners that you're working with, or who's enabling you? Because it's not just Debbie and Rob and you know, people on a board. Who's holding your hands through this, and who's guiding you through this process?
We have a wonderful board. We're a small but strong team. We have fantastic support of the Jewish community, as well as support in the hospice community throughout the province. Our partners, we're working closely with Jewish Family and Child. We've had Circle of Care, North York General Hospital, and the OHT that is centered at North York General Hospital. So we are developing partnerships and alliances with organizations throughout the community. We've been fortunate since day one to have the support of community members, philanthropic community members. Our lead donors, of whom we have 8 lead donors that have given $1 million. Our first 2 donors were Jack Kay and Barry Sherman, and Jack continues to be on our board today. We have this is a project that until now was a very well-kept secret, and even as a well-kept secret, we've grown. Our support has grown to $14 million. We're running a capital campaign of $18 million, and each time we have an opportunity to speak about Neshama Hospice, we gain so much more support. We build our network. People reach out to us and continue to spread the word. So right now, it's we have an ongoing list of supporters. It's really as we reach out, the more people we reach out to, the more supporters we have.
Thank you. And where are you in the process, right? So the two of you met or started dreaming in 2014. It's now 2021, Aseret Yemei Tshuva. Where are you going? Like, where do you hope to be? When do you hope to break ground? What do you still need? How can the people listening help?
Well, we have 5 properties that we bought. It's at Cadillac and Brightwood, so roughly across the street from Bagel World. The capital campaign is moving along well. We hope to break ground next year. We have great support from Councillor Pasternak, from the City of Toronto Building and Planning Departments. We have a strong fundraising team. We just had a a brochure that got sent out in the CJN magazine.
So we're hoping to break ground when?
We hope to break ground in 2022, so next year, and hopefully the build will be completed in about 18 to 20 months. So that's where we're going to. What do we hope to see in the near future as we get into the next phase of development? We will be looking to strengthen our partnerships and start to become involved in community hospice services so that we have resources and a community and networks for when we open our doors.
And one day, it's not uncommon for Rob to accept calls from people who actively reach out and want to help. And they want to know if they can volunteer now. We will be there. We're not there yet. There are key volunteer activities. Volunteers are the engine of any hospice. And we're so looking forward to, involving people. But when you ask what can people do, how can people help? People can share. People can start to have conversations about not just Neshama Hospice, but about advanced care planning in your own lives, and why it's so important for us to have these conversations about what do people want, what are their wishes at end of life, and of course, help find ways if people can give. We recognize that with COVID, it's created all kinds of delays and constraints for so many people. So yes, of course, we look to people's generosity, but we really look to people to continue to talk and have the conversations about Neshama.
Thank you. So you mentioned COVID, right? So I don't know if anyone knows, but there's been a global pandemic since March of 2020. How has that impacted or affected what who Neshama Hospice is, what it stands for, how it will do business?
I think it gave everybody a long time to pause and reflect and think. It changed conversations. It made what would be a taboo conversation about end of life and end of life care and advanced care planning. It brought it to the table, to the forefront, and people had thoughtful conversations that, yes, they're difficult and they're emotional, but everybody benefits from the conversations. So I think in a lot of ways we've found good from an unfortunate pandemic.
It makes me think about Hillel, if not now, when? Because COVID, doing the group with you, Robin, and seeing people and realizing we need to have more places for people so that they are not alone when they are going through these experiences. That was one of the most glaring things for me, was the limits that were placed on visitors and being with loved ones, and hearing those stories repeatedly from people and thinking, okay, we need to find safe and wonderful ways for people to be together during these times.
Thank you. So the theme here at Beth Tzedec this year is Panim El Panim, face to face. You might have seen beautiful renderings of it in some of our publications. Reb Steve and I and Yaakov, we try and throw it in there into our service here and there, because it's true. We've missed face-to-face opportunities so much. We're slowly going into it right now. Who knows what's going to happen when the cold weather comes? Not to be Debbie Downer or Debbie Wonderful. Sorry, I didn't mean to do that.
Well,
so okay. You can tell we're friends, everyone listening.
Yes.
Can you tell everyone who's listening a little bit more how the ability to see each other, Panim El Panim, will take place in the Neshama Hospice? It's maybe the sitting rooms, the kitchens, the rooms, just all of those opportunities. How much kavanah, how much intention was put into the design?
That's a great question. I think again, I want to mention Charles Rosenberg from Hilditch Architects. Charles brought kindness into the building and thoughtfulness in everything he designed. The rooms, as Debbie mentioned, will have a lot of light. They'll have access to a private terrace or private patio, if you will, in each of the individual rooms. As well, they'll have space for the family to come, a sleeper bed for family to stay. Each room has its own shower and washroom. So it really is a small suite for the family, if you will. In the administrative building, the main building, there will be a central living room with a communal area, large communal tables. There will be a central kitchen that volunteers will provide food. There will be fresh baking in the morning. There will be soup. There will be a servery or a reheating kitchen for families that they'll be able to use, as well as a microwave and a fridge in each of the rooms, so that people will be able to observe kashrut that is appropriate for them and their family. But there will be those meeting areas for families to have celebrations, and families that don't know each other but are grieving at the same time in individual spaces can come together and be together. So I think it'll be a warm and welcoming environment.
There will also be areas, quiet rooms where people can have quiet reflection, with light and peacefulness. There will be, as I mentioned earlier, space for kids to be, and including teens as well, making sure that supportive services are available. And again, trying to create this in a home-like environment.
And we will have a spiritual room or a holy space with a Torah and such. So there'll be a place for services and a place for families to reflect.
Thank you for that. I think this is helping people understand a little more what it will be like. When you tell people about Neshama Hospice for the first time, like we're building now, we're doing this now, not your fundraising pitch, but the community piece that this is going to happen now, what reaction do you receive usually?
When are you opening? How can I help? I want to volunteer there. Why, people ask, how come, haven't we had one before?
Yeah.
Similar to the question you asked, and I know, I'm sure many in the audience have also wondered, and that it's special. It is special, because you can't not feel passion or compassion for this project. I believe if you're hearing about it, even just for the first time, I think there's something incredibly meaningful about bearing witness and doing this work. But I also think for this to be a way to enlarge our community, to bring people together, to have an actual place where we can say, you know what, I think this will be the place. Let's consider this being a place for you and your family, as a resource, as a support, and as a pillar of the community. When I think about places like Mount Sinai Hospital, and I think about Baycrest, and I think about the history of Jewish healthcare in our city and in our province, and I believe that Neshama Hospice can and will be a pillar too.
Amen. I really, really hope so. Have you thought ahead yet to how someone would get there? Or are we there yet in our planning? You know, like, God forbid someone I know, end of life, like what would happen? How does it enter into the option world?
You know, a whole referral system will be organized, not unlike when I think about my days working at Sick Kids and we need to find accommodations for families from out of town. You call Ronald McDonald House.
Right.
So there will be referring nurses. We will be doing a bit of a Neshama Hospice roadshow, probably in every hospital, center, healthcare center we know of, to say we're open and this is how we are accepting referrals. And that it can be that case where people say, you know what, maybe I think we need to call Neshama Hospice. Because what's amazing is people are hearing about it now and they're calling us now and we're not even open.
Right. Haven't even broken ground. It's amazing. I think you're right. There's absolutely a need, period. You have found a need and you're filling it. And the challenge is it's not overnight. Because there's so much, first of all, there's all the bureaucracy that needs to be done. And also there's all the money that needs to be raised to do it, to have a state-of-the-art facility that meets all of the needs on all the different levels. Okay. Thank you for this. Are there questions? People have any questions, things I'm going to open up the chat and see what's going on there, see if any have come privately to me as well. Any questions? No, we've got a quiet group here today. Okay. Any last comments from the two of you?
Thank you so much for giving us this opportunity, for inviting us to share and talk about Neshama Hospice. Dina, I want to thank you so much also for supporting our little talk. I really appreciate exactly all the words that you shared and the sentiments that followed. And you can find out more about us online. And Rob's contact information is available. And if people have questions after tonight, don't hesitate to contact us.
Right. And I just want to leave everyone with one ask, which is tell other people about this. Let other people know that this is happening. It's not behind the scenes anymore. It's not a quiet thing of people sitting and, Rob and Debbie dreaming at Starbucks. This is real. This is going to happen. I would say in our lifetime, but no, it's going to happen in the next few years, that it will finally break ground. And I just, the ask, because that's what I do when I speak, I give an ask, is let other people know about this. Spread the word so that people will know about this unbelievable program that's taking place. And I'm just noticing some of the people who are here that had the opportunity to spend time with Debbie and me over the past year and a half, just showing how magical you are. And I know Rob is as well, from all the times that I've had to meet with him. I want to say Gmar Chatima Tova. May we all have a healthy year. And we look forward to continuing to watch as Neshama Hospice becomes a reality. And, for those of you that have asked me even about volunteering, just hold off a little bit, but there will be opportunities for that.
Look at it.
100%. Thank you so much.
Thank you, Robin. Thank you, everyone.